Good morning, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly webinar series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to talk about some data analysis concepts and features within our two websites, hhdw.org and hawaiihealthmatters.org. Today, we are going to talk about two features that are available in hhdw.org and hawaiihealthmatters.org, or HHDW and HHM, age-adjusted rates and confidence intervals. And then I'm going to point out how to easily move from the health indicator report in HHM to a build your own report in HHDW. Many health conditions and risk factors are associated with age. So for example, binge drinking is more common among younger people, and high blood pressure is more common among older people. So when this happens, you might need to age adjust to more accurately compare the health indicators in populations that have different age distributions. So for example, if you were looking at a population on a college campus and they have a very high rate of binge drinking, and you try to compare them to a population that is more rural, that has an older population, you would want to age adjust to see what binge drinking really looks like when you take out the age factor. What age adjusting does is they would make the rates that would have existed if the populations under examination had the same age distribution. So roughly the same percentage of people that were 18 to 24, 25 to 34, etc. And in HHDW, we use the US 2000 standard population when we do our age adjusting. So let's take a look at an example of this. This is high blood pressure distribution by age. So this is the adults that responded that they've ever been told by a doctor or nurse or other health professionals that they have high blood pressure. And as you can see here, among the 18 to 24-year-olds, less than 10% have ever been told, whereas compared to 75 and older, almost 60% have been diagnosed at some point with high blood pressure. So there's a huge difference. There's a very big age gradation in high blood pressure. So if we're going to compare populations, we want to think about this. Here we can take a look at the crude high blood pressure prevalence by year and sex for the state of Hawaii. So we can see here that in 2019, 33% of men and 28.5% of women have ever been diagnosed with high blood pressure. But wait, we know that high blood pressure is very much related to age. We just saw that. So is there a difference in the age distribution of males and females in Hawaii? We can take a look at our BRFIS data, and we can see that between 18 to 24 all the way to about 34 to 35, there are more men than women in Hawaii. And then around this time, it's about equal. And then from then on, there are a greater number of women in the older age groups in Hawaii. So the male population skews young and the female population skews older. We have a condition that skews to the older population. So if we want to really see the difference between male and female high blood pressure rates, you would want to age adjust to take out the difference in the underlying population distribution of the different age groups. So here, again, we have that graph that we looked at, which was the high blood pressure prevalence by sex and year. We can run it also with the age-adjusted high blood pressure prevalence by sex and year. And you can see that while men had higher rates of high blood pressure and crude, when we look at the age-adjusted, it's much more pronounced. And we can go ahead and take a look at the underlying data tables here. And you would see then that in 2019, as we said, 33.9% of men said they'd ever been diagnosed with high blood pressure. But if we looked at the age adjusted, so if we compare them to a standard population, it's a little bit lower. It's 31.7% of men have had high blood pressure. And now if we look among females, so their rate dropped slightly when we look at age adjusted. Females was 28.5% had high blood pressure. And when we look at the standard population, it also drops to 23.7%. And that's because Hawaii actually has an older population than the United States as a whole. So when we compare ourselves using a standard population, then we make our age distribution. We take age distribution out of the equation, and we make our age distribution look like everybody else's. So if we wanted to compare Hawaii data to another state, you would definitely want to look at age adjusting. So we can do that same thing. We just looked at the age distribution by sex. And for some conditions, we're definitely going to want to age adjust when looking at sex. This is what our distribution looks like using our BRFS data by race ethnicity. And I'm just going to focus in on 3 here just to make it a little bit clearer. So this is our age distribution for Native Hawaiians, with the different bars being 18.24, 25 to 34, 35 to 44, etc., right? And this is the distribution of the population among the Japanese. And this is the distribution of the population among those who identify as Black or African American. So you can see that in Hawaii, the folks that are identifying as Black or African American tend to be quite a bit younger than the folks that are identifying as Japanese. So on the Japanese populations, about 60% are 55 or older, compared to if you look here at the Black population, that's going to be only about 20%, right? So it's a big difference. So if you want to really compare a disease condition among these populations, it might be important to age adjust. So let's go back and look at our high blood pressure data. So this is the high blood pressure prevalence crude by race ethnicity, for the self-identified race ethnicity. And so you can see among the people who identify as Japanese in Hawaii, it's very high. It's over 40%. Having looked before at the age distribution, we know they tend to be older, so that kind of makes sense. What happens when we look at the age adjusted? So we'll compare all of these to a standard population. Here you can see then that the numbers change quite a bit. The Japanese go down to less than 30%, and the Native Hawaiian, Black or African American, and other Pacific Islanders, their age adjusted prevalence of high blood pressure when they're compared to a standard population is higher. And so if you're looking about who would be innately more at risk because of race ethnicity and possibly other factors that we are not adjusting for in this analysis, this story looks different than here as a population. However, I would say that if you were saying just among the people who identify as Japanese in Hawaii, this is absolutely true, that they have 40% of those people have been diagnosed as having high blood pressure. Just the underlying risk factor of age is not accounted for in this analysis where it is here. So if we go and we look at this a little bit further, so these are these side by side. I kind of felt it was a little easier to see them this way. And then you can look at the data tables that are applied with that. So let's take a quick look, and we see among Japanese in the crude rate, 40.7% of people who identify as Japanese report having been diagnosed with high blood pressure. But if you look at the age adjusted, so if the Japanese population looked like the standard population, that would be 29.9%. So it would go down. In our Hawaii population, 32.32% of people, of adults surveyed, said that they had been diagnosed with high blood pressure. But if we made that Native Hawaiian population look like the standard US population, it would be about the same at 33.4%. And if we look at our African American population, it was 29.1, because we surveyed largely younger people, right, have it. And if we compare them to and make this population look like a standard population, it would be 34.2%. So you can see that age adjusting, sometimes the rates will go up and sometimes the rates will go down. It depends on the underlying population distribution of something. But by age adjusting, then we can more accurately compare the differences between the risks for high blood pressure prevalence in these populations by eliminating the skew and the difference between our ages. So takeaways for when you're thinking about age adjusting is you want to use crude rates when you want to know the overall rates in different populations. If you're looking at Hawaii against itself over time, we have our population distribution. That totally makes sense, because people don't live in standard populations, right? We live in the population that we live in, where some groups are older than others and whatnot. So in 2019, 33.9% of men and 28.5% of women in Hawaii had high blood pressure, said that they had ever been diagnosed with high blood pressure. But you want to use age-adjusted rates when you want to accurately compare the risk in populations with different age distributions. So knowing that those age distributions are different among men and women, we can say that the age-adjusted prevalence of high blood pressure was 31.1% among men and 23.7% among women. So here, the difference is about 7 percentage points, and here the difference is about 5 percentage points. So again, it's when you're wanting to compare the two groups that it makes sense sometimes to use age adjusted, and that is a tool that's available to you in the hhtw.org. So the next thing I wanted to talk to you a little bit about was confidence intervals. So in science, when we survey a subset of the population, so we have 1.4 million people here in Hawaii, we don't survey 1.4 million people, we generally survey about 8,000, but we use those 8,000 to estimate what that population parameter or that value looks like in the population. So we surveyed 8,000 people. We asked them if they'd ever been told by a doctor or other health professional that they have high blood pressure, and we use their answers to estimate what it looks like for the population as a whole. Because we're using an estimate, we know that it could be somewhere in between there. So we draw something called a confidence interval around this. We use the normal distribution for that. The confidence interval is the probability that that population value will fall between this set of values. In HHGW, we use 95% confidence interval. So we say we are 95% sure that the true value of the population is between here. And so if we looked at it and compared to another population, we would draw that one and say it's 95% sure that the true value belongs between here. And if you're thinking about statistics and you think about, we use the P.05, we think about 1% minus 0.95% is 0.05. So that's what we're looking at when we're talking about statistical significance. So how does this apply in our system? So going back and looking at the high blood pressure prevalence, and we have these little bars that you see here, and these are our confidence intervals. They're seen here. They display them in bars in our charts, and we can also see them. We'll display them in the data table. We'll have the lower confidence interval and the upper confidence interval. So in this first case, when you see here for 2017, these are the 2-point estimates. So the point estimate for males is 32% for high blood pressure, and the point estimate for females is 29.2%. And we know that the males, we say we're 95% sure it's between 30% and 34%. So within that 4% range, somewhere there is the population, the true population prevalence. And among women, it's between 27.3% and 31.2%. Somewhere in there is that true population estimate. And we can see that the highest rate that women could be would be 31.2, and the lowest rate that men could be would be 30%. And if that's the case, then women's blood pressure would be higher. The prevalence of high blood pressure among women would be higher than that among men, right? So because of that, we would say, but if it was 34 compared to 31, then men would be higher, right? But because they overlap, we would say their confidence intervals overlap, we can't be sure in this particular example that men are more likely to have high blood pressure than women. If we look at another year's worth of data, so we come down to 2019, we said at this point, the portion among men has gone up slightly. It's 33.9%, so it's gone up about 2 percentage points. And then among women, it's 28.5. So it has gone down slightly. And we say that the confidence intervals around the male, the estimate for men is 31.9 to 35.9. And among women, it's 26.6 to 30.4. So 30.4 is the highest it could be among women. And if we got it somewhere in here, the lowest that it could be among men is 30.9. They do not overlap. So we would say that they are statistically different. So you can use the confidence interval information in HHGW to do a quick test without running extra software and so forth. This is to be able to see whether or not two estimates are the same. You can also pull it out and run statistical tests and so forth. There is a debate in the epidemiological community. Actually, there are some folks that actually prefer confidence intervals because they're a little more conservative than statistical tests, depending on what you're doing. But this is as good as a statistical, pulling it out and doing extra software. So confidence intervals can be really helpful in helping you understand, since we're just estimating from the population, from our survey sample to the population. So where can I find these features? In hhgw.org, when you select run a report, you'll be able to see whether you can do it by crude rate or age-adjusted rate. Not everything is available by age-adjusted rate, especially if you're already dealing with a subset of the population, say people 50 or older, then we don't age-adjust those. But if it's asked of people 18 all the way to 75, you can do it by both. In hawaiihealthmatters.org, when something is age-adjusted, it's actually written on the definition. So this would be the age-adjusted death rate for breast cancer. So you'd be able to see it there. When you're looking at confidence intervals in the system, when you hover over a chart, you'll be able to see the point estimate and the lower and upper confidence intervals, as well as in the data table that I showed you earlier. In Hawaii Health Matters, again, you can hover over the chart to see the confidence intervals. You can also go ahead and use this feature here to click on and turn on the confidence intervals. And you can also download the CSV for the data. The last thing I just want to show you today is for tips is when you are in HHM and you are dealing with data that's managed by Hawaii Department of Health data that's managed by HHGW, oftentimes you will see this little external arrow and with your data source. When that happens, you can actually click on that to go directly to the Build Your Report feature in HHGW to do more work on this incident. So here, if I was in HHM and I'm looking at adults with high blood pressure, I see it was last measured in 2019. I've turned on my confidence intervals. I want to go and ask some more questions. I can click here, and that will take me directly to the Build a Report feature for this in HHGW. So I'm going to start here at hhgw.org. I invite you to follow along, and I'm going to start from here and go over to Hawaii Health Matters. And I'm going to pull up Finding a Data, Community Dashboard, and I'm going to type in the keyword stroke. So here I can see I have a lot of indicators regarding stroke. I have a stroke death rate, but I'm going to look at adults who experience stroke. And I'm going to look at the state data. So I can look at this and I know that the data is from the Behavioral Risk Factor Surveillance System. So I know that we're going to have that data here. I can do some more work with it. I can see that this is the percentage of adults who have ever been told by a healthcare provider that they've had a stroke. It does not say the age-adjusted percentage. So I know this data is not age-adjusted. I can scroll down and I can hover over to see the confidence intervals around the estimates. I can click here on the chart and I can say show confidence intervals. So that way I can see them there if I'd like to see them that way. I can also do the same here for showing confidence intervals. And I'm going to go ahead and turn on sex here. So we're about to do an example with this and show confidence intervals. If I would like to download the data, again, when I click on the little hamburger, I can always download the CSV, the data itself. I can download the PDF, or I can download the chart if I like it this way. So now looking at this and knowing that this is the crude information, let's say, and I see here that there is definitely a difference in stroke prevalence by age. And I see that there is a male and female difference, but it's not statistically significant because the confidence intervals overlap. I may ask, well, does this hold true if I age adjust? So I'm going to come up here and I'm going to click on Behavior Risk Factor Surveillance System. I'm going to go out and this will take me to the HHGW Build Your Own Report. And here I'm in the adults who have ever been told that they have had a stroke. It does not say age adjusted here. It does not say age adjusted here. I can also look up here just as a little tip and it will say crude. So I know this is a crude rate. I'm interested in the age adjusted rate. And this makes sense because most of our data from BRFIS in Hawaii Health Matters is crude data. So we have that report here, but I'm going to go here and say select a new indicator because I'm interested in looking at the age adjusted indicator for this. So I'm going to go here into chronic conditions and I'm going to look at heart disease and I'm going to look at stroke prevalence. I can hover over here to see what the question is. This would remind me the differences between crude rates and age adjusted rates. But I'm going to look at the age adjusted rate here and I get the standard report. And so for the crude rate for adults who've ever been told to have a stroke, it's 2.8%. And now here in the age adjusted rate, it's 2.4%. So it's slightly lower. But my question was, is there a difference when you look at stroke prevalence by age adjusted by sex? So I'm going to modify my query here and I'm going to go ahead and I'm going to just look at 1 year so I can compare to that other data. And I'm going to look at the data by sex here. And I'm just going to hit submit. And here I can quickly visually see that yes, the age adjusted rate among men is still higher than the rate among women. So it is 2.8 compared to 2.1. I can also quickly visually see that those confidence intervals overlap. And I can confirm that here in the table. The highest this could be is 2.7. The lowest this could be is 2.2. So I would say that while there looks to be a difference, it is not statistically significant. So now I am going to give you a moment to run an activity on your own to take a look at using the BRFSS survey to examine the adult age distribution by county. and then also to compare the crude death rates per 100,000 population with age-adjusted death rates per 100,000 population using the all-cause mortality by sex and census race ethnicity and the Alzheimer's disease by sex and census race ethnicity. Okay, I'm going to start working through the questions here. So the first question is to examine the age distribution by county using the BRFIS data. So we have demographic data in here, and so I would start by looking at it by the BRFIS age group. You'll notice all of these are crude because this is not age adjusted in here. So you're here looking around, especially if you're looking at age. So this is what the age distribution looks like in the BRFIS. So I'm going to modify this query. I'm going to go ahead and look at 3 years of data at a time, and I'm going to look at it by county. So I'll click on county there, and I'll ask it here to look at it by county. By BRFIS age group, and we'll take a quick look. And so I might look at this and think this is not the best vision for me. So I can also go ahead and modify the way that it outputs. So I'm going to look at it with the vertical bar with data labels. And so here I can see looking at Hawaii County, Honolulu County, Kauai County, and Maui County. And as a little trick, if you just want to look at one particular age group or so forth, one of the ways that you can do that is, so for example, if I just want to look at the older age groups, I can click them off here on the side. So I can look at the percentage of people who are 65 and older in Hawaii County versus Honolulu County versus Kauai County versus Maui County. And I'm seeing that it looks like the percentage of people who are older is slightly higher in the non-Oahu counties. So this is a great way to kind of look at and begin to look at some of your patterns here. This is a neat tool to be able to do that. So I would say that it looks like there are younger people. If you look at this age distribution here, that Honolulu County is probably a little bit younger overall than the non-Honolulu counties. And then my next question was going to be to take a look at using some death data. So I'm going to come here to data sources, and we're going to take a look at our deaths per 100,000 population and the age-adjusted deaths, so crude and age-adjusted. In the death query module, we have things set out. So this would be your crude death rates and your age-adjusted death rates. We're going to be looking at the census race data today, just for brevity's sake. And I'll go ahead and we'll run the first one, and we'll take a look at the all-cause mortality. So if we hear on crude death rates, then that gives us our standard report. And if the crude is all-cause mortality, our default is all-cause mortality. So it's people who were residents of Hawaii who died for any reason, and we're looking at it over 2018 to 2020. And you can see that the overall crude all-cause mortality was 807.4, and these are our lower and our upper confidence intervals for that. And then now I want to take a look at this thing by sex. So to do that, I'm going to come up and modify my query. So I'll hit modify query, and I'm just going to run the same thing. And instead of running it by year, because I'm going to be looking all these 3 years together, I'm just going to run it by sex. And you can see that the all-cause mortality is higher among men than among women. You can see that both here in the numbers, and then also you can see it in the confidence intervals, so that there's a higher all-cause mortality among men. And then I'm going to run this again also by race ethnicity. And this is going to be the data, so you can see that it's highest for all-cause mortality among Native Hawaiian and other Pacific Islanders, then followed by Native Alaskan American Indians, then Asian, and then among whites and Black or African Americans. And I can run the same thing by hitting not the crude death rates, but the age-adjusted death rates. But while we're here, I wanted to do the next part of the second question, which is looking at them by Alzheimer's disease. And just to remind you, in order to subset by top cause of death, we come into here for topic cause of death. For this one, I'm going to select the 16 leading causes of death in Hawaii, and I'm going to select Alzheimer's disease. So now we know that our filter, we've filtered on Alzheimer's disease. So I'm going to go ahead and then I can run this by cause of death to get the overall. And I'll also just go ahead and add sex in here so that we can have them both. So I'm looking at deaths due to Alzheimer's disease from 2018 to 2020. And I can see that overall among males, it's 20.0 and it's 50.7 per 100,000 in Hawaii, with our overall crude rate being 35.3. And I would do the same thing now, then I can go back and run this by race ethnicity to answer that race ethnicity question. And we can see here that these estimates for these populations have been suppressed. That means within that time period, there were fewer than 10 deaths. It was between 1 and 9 in these populations. So we cannot give an accurate estimate. I see here, though, in others that it was 17. So we know the count, the number of deaths, but we have to have at least 20 in order to be able to calculate a reliable estimate. So you can see here in the statistic notes why that is that way, but I can come back up here and see then that if you're looking at crude deaths for Alzheimer's, it's much higher among the Asian population, 61.8 per 100,000, compared to Native Hawaiian and other Pacific Islanders. Now I can go back and run these same queries. I'll go back and say select a new indicator, and I can run them here under age-adjusted death rates to be able to answer the second half of those questions. And so that would be, again, this is the overall age-adjusted death rate. So it moves to 561.9, and then I will run it again by modifying the query to look at it by sex. And see the male age-adjusted death rate compared to the female age-adjusted death rate. And then I can run it again by race ethnicity. Again, you can see a big difference here with the Native Hawaiian and other Pacific Islanders and the Native Alaskan American Indians, but you see that the death rate among the Black African American population is quite different when you look at the age-adjusted rate versus the crude rate. And then we do the same thing to come back here and then modify and subset my query to examine the issue of Alzheimer's, which we know has an age component to it. And so then we can look at it by cause of death and sex, and seeing again that there still is an increased rate among women. It's 23.1 per 100,000 compared to 15.5 per 100,000. But when we looked at the crude death rate, it was 50.7 among women compared to 20.0 among men. So you can see there's a definite issue when we age adjust, looking at age adjusted death rates for Alzheimer's. And we would do the same thing then by race ethnicity. So we're seeing here, whereas the Asian death rate was before, among Asians, it was 61.8. Age adjusted is 19.5. Among Native Hawaiian and the Pacific Islanders, it was 34.4 and is now 37.0. So if we wanted to look at and see the relative risk of the average person who's Native Hawaiian descent having Alzheimer's disease compared to the underlying population distribution, you'll see that it is a true issue in the Native Hawaiian population. And as you can see here, none of those confidence intervals overlap. So they would be much more at risk. Whereas if we looked at the crude, we would not see that. Next month, our coffee break will be on the Hawaii Cancer Plan. That will be on December 6th at 11 a.m. And for those of you looking forward to next year, in 2023, our January coffee break is going to be on how to create a custom dashboard within HHM. So we'll be covering that next year.